Hello and welcome. This is Dr. Jerry Cuomo. I'm filming here in my Boca Raton office with my patient, Bam. And before we get started, just to let you know about what Bam has in store today, he's presenting with tooth number 5. I'm going to blow a little air. Bam, do you feel that at all? No, we're good. And we're going to cover the class 5 lesion that he has here, and we're also going to take care of some of this little bit of a decay that he has on the chewing surface, and it's going to be a carbon copy of what we've done on the tooth behind it. So that's our story today, and we're going to do a little special shout out for Bam and Cher. They live in Boynton Beach, and part of the Love Stains, that's their MO, their group, and their company, and so we're happy to work on him today. Right, here we go. We're going to place our Siltrax cord. And right, that's the first step. We'll zoom in on that. Part of what we do now in dentistry is to protect the gum tissue. We really don't want to traumatize that. I know there's a big push for laser technology, laser dentistry. We have curtailed our practice because of the microscope to not include, at least not at this time, the laser. Just haven't really found a big need for it in our practice. Other practices probably have other goals in their practice where they think that it needs to be in just about every procedure. Here we use a lot of Siltrax 7 braided cord, and once that goes in, we'll rinse that off. Alright. Great. Now we're going to score the surface of that tooth a little bit. There we go. Have to get rid of that. There we are. Close a little bit, Bam. There we go. And I'm trying to score the surface. I'm going to use a fine diamond for that, just really gently. And scoring. How you doing, Bam? Okay? Great. Alright, we'll just switch this out. Move on to the next one. Alright, back at it again. The object of the game is to get a nice clean surface. We have to kind of open up the little tubules, get them to breathe. I try to do that first so that we get better bonding, and I think that filling lasts longer on that tooth. So slippery because of toothpaste abrasion. Many people are told it's toothbrush abrasion. It really has more and more studies are coming out now about the toothpaste itself and the hydrolyzed silica that's located in it. So for you lay people out there, it's yes, we have gone to soft toothbrushes, but we still see toothbrush abrasion. Why? Well, number one, it could be the habit of just starting on one side more than other, but we know it's more to do with the toothpaste. Now we've done studies on the number of brushing cycles with paste versus that of the dry brush alone, and huge difference between the two. So remember that. Talk to your dentist about that at home. So we finished scoring that. Now what we want to do is take care of this very small lesion, just starting, but it's kind of pesky. If you leave it alone, it could get bigger over time. So we're going to take care of it. And I'm going to just switch my water on. I'll go ahead and clean that out now. That's you can see how we just go in nice and easy. There's a lot of stain on the surface, so we're going to take care of that stain so we get a little better bonding. Look at that, it's already gone. And it's out of there. Now we got all this stain which we've got to clean off. But in the area of bonding right now, what I'll do is, my goal is to get the grooves cleaned up. And that's our little braided cord from the other side. We'll just tuck that in nicely so it doesn't get in the way. And we'll tuck that one in too. Alright, so I'm going to just double check that anterior region. A little vibration here. That's good. Alrighty. Step. I'm just going to feather that. That's good. Let me have a fine diamond. Right there. Okay. Okay. Yeah. All right. That's cleaning out all the areas that are on the surface. And you can see there's just slight mobility to this tooth, so we'll be adjusting Bam's bite as well. See, there's just a little slight mobility on that one tooth. That's it. Okay. That's the first segment. This is Dr. Jerry Cuomo. We're going to go ahead and fill this. We'll give you an idea what it all looks like in a few moments on the next segment. Thanks for watching.